Hi, I'm Danielle from Occupational Therapy, and today I want to go over pursed lip diaphragmatic breathing techniques. Pursed lip diaphragmatic breathing helps increase our oxygenation, decrease stress, decrease our heart rate. Often we're probably sitting at our desk, breathing and not thinking about how we're breathing, and that's perfectly fine. But sometimes if we're feeling tired, out of breath, if we're feeling increased stress, it can really help our bodies utilizing pursed lip diaphragmatic breathing techniques. Now first, let's find our diaphragm. Place one hand on your upper stomach and give a quick cough. That muscle right there is your diaphragm. Now try to do pursed lip diaphragmatic breathing. Let's put one hand on our diaphragm and the other hand on our chest. Now let's relax our shoulder muscles and our neck muscles and take one breath in and one breath out. If you're like me, your chest rose and fell. For pursed lip diaphragmatic breathing, we actually don't want our chest to rise and fall. We want to try to keep our chest more steady, and we want our diaphragm to actually move out and in. That's using the big, strong muscles of our body to breathe in and out, our diaphragmatic muscles. So now, this time I want to think about how you're breathing. We're going to breathe in through our nose, making sure to keep our mouth closed. So when we breathe in, we're breathing through our nose, and then when we breathe out, we're going to breathe out through our mouth using pursed lips. Now this time, I want to think back to our chest and our diaphragm. When we're breathing in and breathing out, we're going to try to use these muscles here of our diaphragm and not use our chest muscles. Now we're going to integrate diaphragm, breathing in through our nose and then breathing out through our mouth. Let's try it again. So when we're breathing in, we're really pushing our diaphragm, our diaphragmatic muscles, and you'll feel them expand. And then when we're breathing out, you'll feel them come in slightly. Now, when we're thinking about breathing in, where is the oxygen going to? It's going to our lungs. In our lungs, we already have carbon dioxide in them. We never fully expel all of the carbon dioxide from our lungs, and that's fine. When we're sitting at our desk or just doing something leisurely, we really only expel slight amounts of carbon dioxide and bring in slight amounts of oxygen into our lungs. But when we do a few deep calming breaths, utilizing pursed lip breathing, we actually want to try to expel as much carbon dioxide from our lungs as we possibly can. So the technique that helps that is breathing out at least twice as long as you're breathing in. And pursed lip diaphragmatic breathing, I know you probably hear people telling you, take some deep breaths, but have you ever really broke it down and thought about how to do it? It takes practice. It's hard to do. And it's exceptionally hard to do when you're actually doing something else, like exercising or working. It doesn't really come naturally to the body, unfortunately. What comes naturally is some nice shallow breathing that we would just do normally, which is okay. And then if you like to exercise, or if you tried exercising or really expelling your energy and you're like me, then I do extremely shallow breathing. When I'm running, I go. It took so much for me to practice the diaphragmatic breathing while running or exercising or doing something that's stressful and not really focusing on what I'm doing. So now we're going to try to integrate all of those techniques together. Breathing in through the nose, pushing out through the mouth, utilizing our diaphragmatic muscles, not our chest muscles. And then now the last part, blowing out twice as long as we're breathing in. So we'll start short and I'll count. We're going to breathe in, 1, 2, 3, and then breathe out. 1, 2, 3, 4. Now we're going to try again and go a little bit longer. We're going to breathe in through our nose, keeping our mouth closed. 1, 2, 3, 4, 5. And then we're going to breathe out through our nose. Through our mouth. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Were you able to breathe out that long? It's a great goal and a great practice. And remember, it helps so much in our body just taking a few of the pursed lip diaphragmatic breathing techniques. It, of course, as you probably know, helps increase oxygenation to our body. But the little known benefits are that it decreases stress, decreases our blood pressure, decreases our heart rate. It helps natural elimination. So if you're feeling constipated, it really helps as well. There's so many benefits, and it's great to do just a few times a day or anytime you're feeling stressed or out of breath, if you have any blood pressure issues. So try to think about this quick little technique throughout the day, anytime you need, and thank you for giving me a few minutes to go over pursed lip breathing. There's several ways that occupational therapists can help with stress and daily living techniques. So if you need anything, just give us a call. Thank you.